Hey, Dr. Langley here from Pine Ridge Family Medicine. I think there's a common misconception about medicine that I wanted to talk about today. A lot of people kind of think of disease or illness as an apple or just an object of any kind. You'll see why I use the apple in a little while. But it's either there or it's not. You either have it or you don't. There's no in between. I kind of have an apple. No, you either have an apple, you might eat it, you might just hold on to it, or you don't have an apple. But that's not quite the way disease works. I mean, with this idea, you should be able to go into the doctor. They should say, oh, yes, you have an apple. Or they should say, no, you don't have an apple. And that should be it. But a lot of times, especially autoimmune diseases are infamous for being tricky like this, but also musculoskeletal issues, even trying to discern between a viral or bacterial illness, upper respiratory tract infection, can sometimes be more of a journey and less of a it's there or it's not, especially when you come in matters in the course of the illness. So let's say I've got a terrible picture of a tree, maybe even an apple tree, behind me. Hopefully you can see it well enough. So you come in, you're doing your due diligence, and you come in as at the first sign of symptoms, you might be all the way down here on the journey of figuring out what you have. And that can be tricky. You have a bunch of symptoms. They're not necessarily the same symptoms that you're going to have in a week. They might change. And there are certain things that we could test for and certain images that we could check, but they might not show the full picture quite yet. It might take some time, take some other tests to go down the track. And even though we're going to find eventually that your illness is right here, it takes a little time to get there. So first we have to do this certain test, maybe, and then we have to do this certain imaging, and that helps us there. And then you develop this new symptom that helps pinpoint that this is what's really going on. But that took time. And it's not because the doctor's not doing their job or didn't want to run the right tests right away. It wasn't the right time to to do those tests early on. It's later that those are really going to be the most helpful. That's kind of how I like to picture it when it comes to figuring out especially complicated or tricky diagnoses. So in summary, talk with your doctor about your concerns, communicate with them, and keep in mind that not necessarily everything that they need to make the diagnosis is there right away, and not every test is useful at every step of the way. Stay in good health.